Sepsis. It's a word that strikes fear in the hearts of doctors and families alike. This life-threatening condition, triggered by the body's overwhelming immune response to infection, can rapidly progress to organ failure and even death. But there's hope. With early recognition and swift medical intervention, lives can be saved. This is why we're going to delve into the critical first few hours of sepsis care, exploring the 6 key elements that can make all the difference. One of the first lines of defense against sepsis is ensuring adequate oxygen supply to the body's vital organs. When sepsis strikes, the body's ability to deliver oxygen to tissues is compromised, often due to low blood pressure and impaired blood flow. This is where supplemental oxygen therapy comes in. By delivering oxygen through a mask or nasal cannula, we aim to maintain oxygen saturation at a level that supports organ function. However, it's not as simple as just pumping in more oxygen. Excessive oxygen can be harmful, leading to oxidative stress and lung injury. This is why careful monitoring of oxygen levels is essential, adjusting the flow to meet the patient's specific needs. Think of it as fine-tuning a delicate instrument, striking the right balance between providing enough oxygen without causing unintended harm. This personalized approach, guided by continuous monitoring, is crucial in optimizing oxygen therapy for sepsis patients. Intravenous fluids are another cornerstone of early sepsis management. The goal is to restore and maintain adequate blood pressure, ensuring that vital organs receive the blood flow they desperately need. But here's where the delicate balance comes into play again. While rapid fluid administration is often necessary, too much fluid can be detrimental. It's not just about filling a tank, it's about supporting the circulatory system without overwhelming it. An overloaded circulatory system can lead to fluid buildup in the lungs, making it harder to breathe and potentially worsening outcomes. This is where careful assessment of the patient's fluid status is paramount. We use a variety of tools and clinical signs to guide us, monitoring urine output, assessing for signs of fluid overload like swelling, and even using ultrasound to visualize the heart and blood vessels. This meticulous approach allows us to tailor fluid management to each patient's unique needs. The quicker we can suppress the infection fueling the sepsis fire, the better the chances of survival. This is where antibiotics take center stage. These powerful medications are crucial in neutralizing the bacteria that have triggered the body's overwhelming immune response. But the choice of antibiotic is not a one-size-fits-all approach. It's like a detective piecing together clues, identifying the culprit behind the infection. We rely on factors like the suspected source of infection, the patient's medical history, and local resistance patterns to guide our antibiotic selection. This is why obtaining blood cultures before administering the first dose of antibiotics is so vital. These cultures help us identify the specific bacteria causing the infection, ensuring we're using the most effective weapon in our arsenal. And as we wage war on these microscopic invaders, we must also be mindful of a growing threat: antibiotic resistance. The overuse and misuse of antibiotics have fueled the rise of superbugs, bacteria that have developed resistance to commonly used antibiotics. This makes our battle against sepsis even more challenging, underscoring the importance of using antibiotics judiciously and following local guidelines. In the fast-paced world of sepsis care, every minute counts. Yet, amidst the urgency, there's one step we never skip: drawing blood cultures. These cultures, taken before the first dose of antibiotics, are like sending a search party into the bloodstream, hunting for the microbial culprit behind the sepsis. They provide invaluable information, identifying the specific type of bacteria causing the infection. This allows us to fine-tune our antibiotic selection, ensuring we're using the most effective weapon against the invading pathogen. But timing is everything. Administering antibiotics before drawing blood cultures can mask the infection, leading to false negative results. This is like trying to find a needle in a haystack after someone has removed half the hay. It becomes much harder to pinpoint the source of the problem. By obtaining blood cultures promptly, before initiating antibiotics, we maximize our chances of getting a clear picture of the enemy we're fighting. Imagine your body as a complex machine, with each organ playing a crucial role. When sepsis strikes, this well-oiled machine starts to malfunction. One way we gauge the severity of this malfunction is by measuring lactate levels in the blood. Lactate, a byproduct of cellular metabolism, is like a distress signal released by cells when they're not getting enough oxygen. Elevated lactate levels indicate that the body is struggling to meet its energy demands, often a sign that organs aren't receiving enough blood flow. Think of it as a car engine overheating when it's low on oil. The higher the lactate level, the more dire the situation. Monitoring lactate levels is like keeping a close eye on the engine temperature gauge. It helps us assess the severity of sepsis, track the effectiveness of our treatments, and guide our decisions regarding further interventions. It's a vital tool in our fight to restore balance and support the body's ability to heal. In the intricate web of the human body, the kidneys play a vital role, filtering waste products from the blood and maintaining fluid balance. But when sepsis takes hold, this delicate filtration system can be compromised. One of the earliest and most sensitive indicators of kidney function is urine output. By carefully monitoring the amount of urine a patient produces, we gain valuable insights into how well their kidneys are functioning. A decline in urine output can be a red flag, signaling that the kidneys are struggling to keep up with the demands placed upon them. This is where accurate measurement becomes paramount. It's not just about eyeballing the amount in a urine bag. It's about precise measurement to detect even subtle changes. In some cases, a urinary catheter may be necessary to obtain accurate measurements, especially in critically ill patients. While catheterization carries its own set of risks, including urinary tract infections, the benefits of close monitoring often outweigh the risks in patients with severe sepsis. By keeping a watchful eye on urine output, we can identify early signs of kidney dysfunction and intervene promptly, potentially preventing further damage. Sepsis is a race against time. The sooner we recognize the signs, the faster we act, the better the chances of survival. Remember, early recognition and swift medical intervention are key. By understanding the importance of the sepsis 6 oxygen, fluids, antibiotics, blood cultures, lactate, and urine output, we empower ourselves with the knowledge to advocate for ourselves and our loved ones. These 6 elements, combined with vigilant monitoring and timely interventions, can make all the difference in the fight against sepsis.